All right, Dr. Justin here with Dr. Shea. We're talking leaky gut today. So, Dr. Shea, what is leaky gut?
Oh my gosh, great question, Doc. As many of us have already started to hear, leaky gut is becoming a big issue, a big topic of conversation. So simply, what leaky gut is exactly what it sounds like. Your gut is leaking and it's getting into your bloodstream, causing inflammation, causing a host of different problems. So the way the gut actually works, your intestinal system, your GI tract, is supposed to be a closed system. Well, some things are allowed to go in and out. It should be more like a net, but a very controlled net. But when we get stress, when we get inflammation, we get toxins, we get bad foods, that stress we were just talking about, toxins, it can be heavy metals, things that are in those foods, bad bacteria, too much good bacteria, parasites, viruses, anything like that, any kind of pathogens that make it into our system, causing inflammation, causing damage on our intestinal walls, then you get these big openings. Now, there used to be small channels, that controlled net that I was talking about, but now that we have damage to the gut lining, these controlled nets are now much larger. Imagine a net that just caught on fire. Now you have these monster holes in them, and now those foods, those stresses, those things, they're making it into our bloodstream, making it around two different parts of our body, causing a ton of different symptoms and just many conditions that should be avoidable. Doc, why don't you run into some of the things that if you are experiencing leaky gut, these are the things you might be feeling.
Yeah, and it starts out with simple things like gas, bloating, diarrhea, constipation, IBS is a big one, to things like chronic diseases like Crohn's disease, and different autoimmune diseases as well.
Just like me.
Yeah, come from leaky gut. Now, it can also affect the skin. We see a lot of skin conditions from rashes to acne and different things as well. And we actually go into detail. We actually have a leaky gut ebook. So make sure you go and download the ebook because we go into a lot of detail. But today we really want to go through the 3 R's of what we do to actually help patients with leaky gut. Why don't you hit those 3 R's, Doc?
Let's hit the first one. All right. So first one is reduce. You have to reduce your inflammation. Just like I was discussing earlier, these things right here, when they make it into our system, they cause inflammation inside of our gut, destroying that inner lining. So we have to reduce inflammation.
Yep.
Get that down.
Reducing that inflammation, one of the things we look at is what is triggering, what's actually causing the immune system to actually fire and be inflamed. One of the big things that we see is food allergies.
Definitely.
And that's why one of the things that we start with is actually doing a food allergy test. Because it can show, hey, are there things that you're putting into your body that's triggering the immune system that actually is causing that leaky gut to get even worse? And there's a second test. What's the second popular test?
It's the poop test.
The poop test, that's right.
Officially, it's called a stool test inside of our office. So the food allergy test determines what goes into your body that causes inflammation, causes that leaky gut problem. The stool test already determines what is already inside your system that is already causing a problem. Like I said, there's good and bad bacteria in there. So it determines how much good, how much bad. Is there other things to worry about? Viruses, parasites, things like that. Things we don't really want to talk about. Yeast overgrowth, candida. If you're high in sugar intake, candida and yeast can be a big problem because that's what sugar actually feeds those issues. So reducing the inflammation, it's number one. And we got to start with testing. You got to figure out exactly what's happening with your body and in your diet that causes inflammation.
Yep, so we'll go to the second R.
We got to rebuild. So after we've reduced the inflammation, we've reduced the causes of what caused the leaky gut, caused those larger openings to happen inside the intestinal lining. Now we got to rebuild it because those holes are there and they're not going to repair on their own, so we can kind of try to help rebuild those things. What's a couple of things they can do, Doc?
Yeah, one of the big ones is bone broth protein. It's a good source of protein to actually help seal up the leaky gut itself. And again, go get the ebook because we're going to go into detail of how to actually repair this. We just wanted to get you some of the simple tips. But one of the ones, on a daily basis, start adding bone broth protein.
And the good thing about bone broth protein is what a lot of people don't know, the intestinal lining isn't mostly made up of muscle proteins. It's made out of collagen proteins. And bone broth is one of those things that you can actually get a lot of those collagen proteins in the body so you can heal the gut the way it needs to be done.
Yep. So we'll go to the third R.
Third R, We got to revive the system, because after we've already reduced the inflammation, we've repaired and rebuilt those holes, now we have something inside of our gut. Go back to those bacteria we were talking about, those good and bad ones in there. We call that whole system your microbiome. Actually, fun fact, Doc, if you were able to scoop all that bacteria out of your intestinal lining, these microscopic guys that you can't even see, and put them on a scale, they'd weigh anywhere between 2 and 3 pounds.
Yeah,
it's astronomical.
Crazy. Yeah, people don't realize that we have so much bacteria in our gut. And some of it's supposed to be there, some of it's not supposed to be there. So that testing really will show us, hey, is there an overgrowth of bad bacteria? Is there even an overgrowth of your good bacteria that can actually cause problems? Is there overgrowth in yeast, things like that Dr. Shea mentioned? But yeah, we got to look at, okay, where is the microbiome? And our microbiomes are destroyed. What's one of the biggest things that destroys the microbiome?
Oh, you set me right up. Perfect. So one of the biggest things when Dr. J was talking about the symptoms and problems leaky gut can come with, the inflammation, bloating, autoimmune disorders, thyroid problems, hormone problems, stuff like that. Usually one of the main things that doctors go to, number one thing, is antibiotics. And antibiotics doesn't favor just the good guys. It destroys everything. Just imagine a forest fire that goes straight through the woods. It's not going to favor just the good or just the bad. It's going to take out everybody. And that's what antibiotics truly does. So you have to revive that microbiome, because that is essentially 80% of your immune system lives inside your gut. And it's all those little critters down there that keep it alive and going. I think probiotics too, Doc.
Yeah, definitely the proper probiotics. And again, what tells us, we don't just recommend supplements to everybody, because no two people are the same. We want to look at your testing and see, what does your testing show to show us exactly what you need. But a big thing about antibiotics is, well, one of the things with leaky gut is anxiety and depression.
Oh, yeah.
So a lot of mental health issues actually come from gut issues. And as you start repairing the gut, because the serotonin is actually produced from chemicals, your gut is actually signaling to the brain to produce those chemicals. So if the gut is off, mental clarity, brain fog, but really anxiety and depression, we help people a lot by helping restore that gut microbiome.
There has yet to be a patient that came into our office when they're joining our new program called The Wellness Way, where we start to stop guessing and start testing the body. There hasn't been a patient yet that's been dealing with a leaky gut problem or any kind of related symptom that isn't dealing with some sort of intense anxiety, depression, sleep disorder, something along those lines. So we're starting to really notice a connection between what happens here and what's going on upstairs.
Yeah, because the mood, if you think mood, think gut. You got to start there. It's not really about the certain foods, the different supplements you can take. Really think, hey, do I need to repair my gut? And when you start repairing your gut, then you can actually look at, okay, how do these foods affect me? How do these supplements affect me? But really, got to start repairing it. You got to reduce the inflammation, rebuild, and revive. And again, like Doc said, we don't guess, we test. So make sure you come see us. Let's get you tested, see what we can do to help you. And also, download our ebook. It's going to go in detail, things that you can do to start now.
Definitely.